Bismillahirrahmanirrahim. Sabko mera salam. Thank you very much for being part of this August gathering that is collected here. And I honor Dr. Nighat Shah for her work and her, I think, extremely important work that she's doing, at the same time her leadership in bringing forth problems that she is facing and then finding solutions for them. That is one great achievement that she has done. And उसमें मैं first of all cardiomyopathies और rheumatic fever की जो ladies आती थी pregnant, उनके लिए ख़ास तौर पे cardiac unit NICVD में जो है उनकी referral pathways बनाना, it was a great achievement. इससे maternal mortality हमारी जो है स्पेशली फॉर कार्डियक मदर्स विद कार्डियक प्रॉब्लम्स वो रिड्यूस हो जाएगी. लेकिन ऑब्वियसली दिस इज़ जस्ट वन ड्रॉप इन एन ओशन वे द होल ऑफ सिंध में कितनी मदर्स हैं who are cardiac patients and then are getting pregnant multiple times and then obviously as a result dying. Maternal mortality जो है बहुत तकलीफ दे है. Obviously that is one thing that we really want to curb. और उसके लिए हम एक मैटरनल मोर्टेलिटी रजिस्टर और उसके साथ साथ हम जो है उसकी जो है ऑटोप्सी फोरेंसिक ऑटोप्सी ऑफ मैटरनल मोर्टेलिटी केसेस, ईच एंड एवरी केस वी हैव टू डू. अभी हम बंडल प्रोजेक्ट जो है ऑफ पीपी फॉर पोस्टमार्टम हेमरेज वो भी शुरू करने जा रहे हैं. आई थिंक जेपीएमसी में शुरू हो गया है एंड सिविल में, and we're going to see what results we get from here, and then we're going to expand it to other districts of the country, of the province, sorry. And हम चाह रहे हैं कि जो result जो हमें जो भी evidence मिलता है, evidence based हम जो हैं जो है policy making में हम evidence based जो है चीज़ें डालें. जो शहनाज वज़ीर अली said that we are in the process of making our health and population policy, which is it is clubbed together because both of them cannot be separated. They're integral part of each other. So वो हम policy जो बना रहे हैं, it should be evidence based, and whatever lessons we've learned should come out very strongly in that policy. So we are really looking forward to having input from all the stakeholders, the people in the forefront who can give us an input in the population policy. और मैं इधर जितने भी लोग बैठे हुए हैं उनसे मैं कहूँगी कि प्लीज़ काइंडली आप अपने मशवरे जो हैं वो काइंडली हमें रिटर्न भेज दें टू द डिपार्टमेंट ऑफ हेल्थ, ताकि हम उसमें इंक्लूड कर सकें जो पॉलिसी जो हम बन रही है. फेडरल की एक स्ट्रेटेजिक फ्रेमवर्क फॉर पॉलिसी बन चुकी है, बट दे आर स्टिल इन द प्रोसेस ऑफ मेकिंग अ पॉलिसी बेस्ड ऑन दैट फ्रेमवर्क. और हम जो है हम प्रोविंस भी अपनी दो दे हैव गिविंग चैप्टर्स फॉर प्रोविंसेस, but I want our own policy, as Sindh has been in the forefront of everything in health and family planning. Especially, I think we are in the forefront, and we need to include what our experiences are, what our understanding and learning has been regarding not only family planning but health as well. So ये चीज़ें हम डालने जा रहे हैं. My one concern is, and I'll be spelling it out very loudly, is कि हमारे पास जब एक मदर आती है with eclampsia, we don't have an ICU facility in every facility that we have. हमारे यहाँ डिस्ट्रिक्ट हॉस्पिटल्स में ICU फैसिलिटीज़ नहीं हैं मदर्स के लिए. हमने न्यूनेटल ICUs तो शुरू कर दिए हैं और पीडियाट्रिक ICUs शुरू कर दिए हैं, एटलीस्ट इन द टर्शरी हॉस्पिटल्स, एंड वी स्लोली एंड ग्रेजुअली मूव देम to other places as well. But we really need maternal ICUs, which are very lacking. And इसके लिए obviously the problem again is anesthetists. There's a lack of anesthetists, and I've been today also I spoke to JSMU and Dr. Shahid also and the other doctors sitting here. हम सिविल हॉस्पिटल में एक डिप्लोमा कोर्स शुरू करवाने जा रहे हैं anesthetists का. I'd say a similar diploma course should be started here, which should be for 2 years. Maybe we can squeeze it down to 1 year, but anesthetists इतने ज़रूरी हैं. But we don't want killers. We don't want anesthetists who are half trained and who cause more deaths than they have a high ratio of deaths. We don't want that. But we at the same time we want more anesthetists, because otherwise we can't run our ICUs, we cannot do OTs with C-sections, and for others, orthopedics and general surgery, uske liye bhi, we don't have enough anesthetists, which is one of our great problems. I agree, digital marketing is very important, and digital marketing, and I know Dr. Rab is sitting here, social marketing expert, and so really speaking, digital marketing in the youth, with the youth engagement, and that is very, 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 very useful, and we have to do that. As Shanaz said, this is a digital age, and I may be very uninformed about technology, but I think our youth is very well informed, and I think we should engage with them through digital means. और हमारे यही वजह है, अज़रा हसन ने जो प्रोग्राम बनाया है यूथ वाला, बाखबर नौजवान, बाखबर नौजवान, वो जो है, it's an extremely good tool to engage our youth. So वो उन्होंने ऐप भी बनाया, उसका पूरा प्रोग्राम बनाया. I think all the youth should go and download that program and learn from it. बहुत सारी चीज़ें यूथ में कर रहे हैं. We are engaging, we are making youth ambassadors for family planning. We are also having workshops in universities and degree colleges ताकि youth को engage किया जाए. Obviously they are future parents, so they should know everything about family planning and services that are available for family planning. दूसरी चीज़ जो हम कर रहे हैं for maternal mortality is we are spreading out our delivery centers, our labor rooms, जो है हम GDs में भी हम birthing stations बना रहे हैं जिसमें normal delivery with a referral pathway to secondary facilities where C-sections can be done, वो भी कर रहे हैं. We have to reduce the rate of C-sections. Maternal mortality, morbidity is related to C-sections, and we have to reduce our C-sections. And अभी भी हमारे यहाँ high rate of C-sections है, and obviously private sector में बहुत ज़्यादा है. Government sector, unfortunately, because tertiary hospitals receive the cases at the last stage, तो वहाँ उनको मजबूरन C-sections करना पड़ता है. But the rate of C-sections in private sector has to be reduced, and that's the only way we talk about maternal mortality, but what about maternal morbidity? The fact that she is undergoing C-sections for every delivery that she's coming for, 3 deliveries, and she's undergone C-sections. So that is something that we should reduce also. Maternal mortality has to be reduced, and I think we need to come up with a plan for how maternal mortality can be reduced. And I think you all are all experts sitting here, gynecologists and obstetricians. You should work on a plan. Give it to me, like we, SICHN का हम infant mortality देख रहे थे, high हो रही थी. Neonatal mortality was very high. So we started the SICHN program, and that is working towards reducing. Obviously, we haven't spread it out to every district in the province, but slowly and gradually, when it goes down to trickles down to every district in the province, तो बहुत फ़र्क पड़ जाएगा इससे, और infant mortality and neonatal mortality reduce हो जाएगी. हमारे यहाँ फिर भी perinatal mortality is very high, our maternal mortality rates are very high. We need to see methods and ways of reducing that. Perinatal mortality and neonatal mortality is also linked with maternal health, और हमने बहुत काम करना है maternal health पे, adolescent girls की health पे especially, so that we reduce the moribund girls who are going into becoming mothers of the future. उनको हम अभी से tackle करें, उनकी deworming, उनकी iron deficiency या micronutrient deficiency, उनको उसको जो handle करें ताकि when she becomes a mother, she's a healthy mother. So I agree, patriarchal society है, we know it's a patriarchal society. The mother is the last person to have the meal in the household. पहले वो अपने बच्चों को देती है और husband को देती है, फिर वो खाती है. तो really speaking, she just gets the leftovers. I've seen mothers, eating from the leftover plates of their children, which is what a mother is all about. She's nurturing, she's caring, and we need to save her. She's the last hope of our generations that are coming now. They have to be nurtured, they have to be given the best of care, and only a mother can do it. And a household that loses its mother is a very unfortunate household. So then the children are very unfortunate, and as was said here, there is a lot of things associated. और डॉक्टर शेरशाह ने कहा कि वो बच्चे किस तरह के टर्न आउट होते हैं जिनकी माँ नहीं होती, वो तो हम सबको पता है कि what is the end result of children who don't have a mother to nurture him or her. So I'll be very happy. I'm very happy to be part of this international summit that has been convened, and I wish you all the best in the coming sessions that are to be done. And I think this is the only way to go forward. Let's all come together, discuss things, find methods and ways to bring forward change in our society. And change is very necessary, and we're still looking for change in every sphere of our life. Thank you very much.